name's Josh and I'm the Director and Sports Chiropractor at Pro Chiro. Today we're going to be talking about runner's knee and how chiropractic care, as well as certain exercises, can help you to recover. So the medical term for runner's knee is patellofemoral pain syndrome, and it's often felt in the front of the knee, sometimes above or below the patella or the kneecap. Runner's knee is often brought on by suddenly increasing the intensity of running. So either the amount of times running in a week or the distance running. Sometimes it's brought on by suddenly changing footwear or changing from soft to firm running surfaces. In other words, it's brought on by increasing the load being placed on the tissues around the knee, causing some of the structures to start causing pain. One of the best ways to help manage runner's knee is to alter the load that you're placing on the structures around your knee. This is normally by adapting the amount of times a week you're running or adapting the intensity of those runs to allow the structures around the knee to recover. Because if you're still running with high intensity and high frequency while you're trying to recover from runner's knee, you'll just make the whole recovery process a lot more drawn out and a lot more lengthy than it should be. Sports chiropractic treatment can help you to recover from runner's knee by helping to get the hip and the ankle functioning better. Because if the hip or ankle suffer from any movement deficits or strength deficits, then the structures around the knee will have to compensate to make up for it. And those structures will have to work harder and harder, and eventually they'll lose their injury tolerance and you'll start to suffer from pain. So to help improve the ankle or hip, it often involves doing some extremity adjustments for the ankle, as well as any relevant soft tissue treatment through the hip or ankle to allow those areas to function better and therefore reduce the strain being placed on the knee. On top of hands-on treatment, another area to focus on when you're recovering from runner's knee is the strength of the muscles across your pelvis and through your hips. If these muscles start to lose their strength or start to lose their activity levels, then the muscles and the ligaments across the knee are going to have to work even harder to compensate for this. And that's when they're likely to start causing pain. So to help get the muscles across the pelvis as functional as possible and as strong as they need to be, we need to start getting the glutes strengthened. The best exercises for that are the following. So one of the best exercises to help improve the strength of your glute muscles is a band-resisted glute bridge. So to perform this exercise, you need a resistance band. You could do this without the resistance band, but the band just helps to get the glutes even more active and therefore is a more efficient exercise. So with the band, you're going to tie it around your knees. Like so. And then you're going to get into a glute bridge position. So lie on your back with your feet about hip width apart. From here, you're going to slightly flatten your back into the floor, and then from that position, you're going to lift your hips up so that your knees, your hips, and your shoulders are in a diagonal line down. While you do this, you're having to press into the band to keep your knees as far apart as your feet are. And you're going to repeat that 5 to 10 times. Repeat that for 3 sets and do that 3 times a week. One of my other favourite exercises for improving the strength of your glutes is the monster walk. And this is another exercise done using a resistance band. So to start, you're going to tie the resistance band around your knees again, similarly to the other exercise we did. And you're going to then stand with your feet about hip width apart, your knees a bit bent and your hips a little bit bent as well, so that you're not standing vertically upright. From this position, what you're going to do is take steps side to side, making sure that you lead the step with the knee rather than with the foot. Because if we lead the step with the foot, the knee will be collapsed inwards and your glute muscles won't be as active as if your knee is over your foot. Therefore, if you do the incorrect way, the exercise won't be very efficient. So what you're going to do is take steps side to side, leading the step with your knee, and you're going to do 10 steps to each side, then have about 60 seconds rest, repeat 3 times, so 3 sets of 10 reps, and repeat that 3 times a week.